Meantime, a new model in low-priced emergency health care goes online tomorrow in our area. Ned Hibbert is here live with that story. Ned.
Yeah, Melinda, when many people get sick, the very first doctor they consult is this one, Dr. Google. Now, it's true, Google does put a lot of information at your fingertips, but here's the thing, he's not always right.
But folks are reluctant to go to an emergency room because they're not sure how serious it is, or maybe they just can't afford it. So what if you could type in your symptoms on your home computer and get a diagnosis?
Hi, Ned. Welcome to virtualers.com.
From an emergency room doctor. The brand new Bellaire ER was built with 3 telepods where doctors can consult with patients over a secure internet connection at a cost of $49 per event.
There is no other emergency room anywhere in the nation doing this, anywhere.
Here's how it works. You go to the website, Virtual ERs, enter your symptoms, medical history, and credit card number. Within minutes, you're talking to a doctor. For this demonstration, I logged in from an adjacent pod, pretending to be suffering with a migraine.
If this is your typical migraine headache that you normally get, it would be safe for me not to examine you and call you in some medication so I can electronically prescribe that through the internet.
Now, of course, not all patients can be treated remotely, says Dr. Mario Quintanilla. The doctor's job is to separate the life-threatening from the take two and call me in the morning.
Do they need to be seen immediately? Do they need to be seen tomorrow by a cardiologist, next week by a dermatologist? Or can they simply be treated without being touched?
So is this effective medicine, or is it a step too far into cyberspace? Like any good patient, we went for a second opinion to an ER doc with the Harris County Medical Society.
One still cannot get an x-ray or diagnostic testing done remotely. That time may come. But I think for some symptoms to evaluate the severity, this could be done very appropriately through telemedicine.
Evaluating the severity, that alone could save cities big bucks. For example, if you dial 911, Bellaire will send these guys to help you, even if basic first aid is all you need.
If we could distinguish between those, keep our paramedics in service for the major calls and let the Bellaire ER deal with the minor calls, that would be ideal.
This may be the first time you've seen a virtual house call. Dr. Quintanilla is betting it won't be the last.
I think this is going to transform a lot of what we do in healthcare today.
Now, the virtual ER service goes live at 10 a.m. tomorrow morning. We have a link on our website, myfoxhouston.com, on the Seen on TV page. And I'm told most insurance companies will cover that $49 fee. Do the math. It ends up being a whole lot cheaper than visiting an actual emergency room. Back to you.